I need to close my window.
Well, welcome everybody. Thank you for joining us. I am Megan of the Train with Trust Project, here with Jody Ambrose, also of the Train with Trust Project. We are a nonprofit organization dedicated to making animal behavior information accessible to everyone. And as always, we are joined by Dr. Sue Dyson, world-renowned equine orthopedist, veterinarian, and author and researcher. And we have been doing a series for quite some time, all topics related to the 24 behaviors of the ridden horse in pain, shifting the paradigm of how we see lameness, a film that came out about 2 years ago. It's free to view on YouTube. For those of you who haven't seen it, it would be great to check it out, and you can find it on our website, 24horsebehaviors.org. And as I mentioned, we are a nonprofit organization. So if you like the content that we're producing and you'd like to see more of it, please check out our website. And if you're so inclined, provide us with a donation to help keep us going. Today, we are going to be talking about following up a little bit with our conversation from last time, which was about veterinary examinations and what to expect. And Dr. Dyson giving a lot of input about how those can be most effective and what you can do to make them more effective. And today, following up on that, we're going to be talking about pre-purchase examinations and that entire process, which can be fraught and challenging. So I'm going to, with that, turn it over to Jody. I will be in the background taking questions. If you have any questions, go ahead and pop them in the comments and we'll do our best to address them live. And if not live, we'll follow up with answers for you. And thanks again for joining us. And I'll turn it over to Jody and Dr. Dyson.
Thanks. So this is going to be an interesting topic, definitely, because I think if you've been in the horse industry for any amount of time, you probably know of someone who's bought a horse to have it go have problems shortly thereafter. And you probably also either have or know of someone who's had a horse not pass a pre-purchase and then that horse has gone on to be just fine. So I think, people want pre-purchase exams to be sort of a binary pass or fail thing. But I know when I was a kid, they used to give a pass or fail score or a percentage score of to after a pre-purchase, and then over time they sort of phase that out because there's just so many variables to consider when you're doing a pre-purchase, and there's never any guarantees. And so I think what we're going to try and do today is talk about the topic in a way that will help people make the various decisions that you have to make during that process. If you're a first-time horse purchaser, it can be really daunting. Usually you're very dependent on a trainer and a vet for guidance, and we'd like to empower people to feel a little more in control during that process because we all like to trust the professionals we work with, but ultimately it's up to you to make these decisions and decide what you're comfortable with and what you're not, whether you're going to move forward after an exam. And I think the first most key principle of a pre-purchase is to go into it not having already decided that you're going to buy the horse because there's so much information that is going to be gathered and offered to you that you need to go into it with an open mind and take it all in because there's just so many things to consider. So Dr. Dyson, can you talk first about what a buyer needs to do before a pre-purchase? What's the setup that would help a vet have the most success with an exam?
Well, I think we have to go back a step and say, caveat emptor, buyer beware. I've had lots of experience throughout my life as a buyer of horses, as a seller of horses, and also somebody who's tried to advise buyers as to whether or not a horse is suitable for purchase or otherwise. And I think for you as a buyer, you have to be very clear in your own mind what you want and what you want a horse to do, bearing in mind that a horse might be suitable for somebody else, but temperamentally it might not be suitable for you. And it's really important that you are not overly influenced by a vendor who is trying to make a sale and is going to tell you this horse is perfect for you because they're encouraging you to buy the horse. So it's well worth having an independent advisor to help you. If it's your trainer, I think it's important that you know whether or not that trainer is acting as an agent. So are they getting any financial reward by enabling the transaction between the vendor, the seller, and you? Because if they are involved in it financially, they're not going to be unbiased. And you would be better off having advice from somebody, even if it's a friend, who can look objectively at the situation. Because I think, and I know I've done this myself, you really want to buy a horse and you may have seen several horses which are not suitable and you're beginning to get a little bit desperate. So you see the next horse with this kind of feeling in the back of your mind, this is going to be the one. And you tend to then look through rose-colored spectacles rather than standing back and looking objectively. And I encourage people now, even before they go and jump into their car and go and see a horse, that they do their homework. And doing their homework for me means getting reasonable quality video footage of this horse ahead of time so that you can see this horse ideally being worked on the flat under saddle and ideally also being trotted in hand and lunged so that you get an impression about the horse's quality of movement and its behaviors. And we'll talk more about behaviors later. Because I think you can save yourself a lot of wasted time by just evaluating those videos and saying, no, this isn't the horse for me, rather than getting in the car, driving 75 miles, getting out of the car and looking at the horse and thinking, I don't like this. Why did I come here? And then being persuaded by the seller to ride the horse and then being persuaded by the seller that, oh, this fits you wonderfully, go ahead and have it vetted, when you're not in the right state of mind. So I think it's better to take time initially. And I certainly give lots and lots of advice before people even go and see a horse. I will look at video footage for them and say, this is worth going to see, or don't go and see this. This is just not worth it. So I think that's time well spent. I think that if you are buying a horse with a view to it, it is currently a competition horse, then you need to spend time looking at its competition record and looking at the quality of its performance and if there have been any notable absences of it from competition. So you need to be aware, why has there been a 5-month gap? What is the reason for that? Was it because I had a medical problem? I think you also need to be very careful about buying a horse which is not currently in work and has not been currently in work for some time. The seller may tell you, oh, well, my daughter lost interest, and so it's been out in the field for the last 6 months because she's gone off to college. Well, I wouldn't necessarily believe that. I know that the horse world is inherently a crooked world, and we have to be very careful and somewhat cynical about the information that we're given. And if a horse is not in regular work, it's very difficult both for you as a purchaser to know what's going to happen with this horse when it does resume regular work. And it's impossible for a veterinarian to be able to predict what's going to happen, because it may well be that if the horse had a problem, a physical problem that was, for example, causing lameness historically, it's had 6 months off, it's resumed work 2 weeks ago. We don't know when the work intensity is upped, whether or not that lameness problem is going to recur. So I think that's a very bad situation to be thinking about buying a horse. Now, if it's an unbroken 3-year-old, well, you're going to take a gamble on the unbroken 3-year-old. But if it's a horse which was competing and then had a period of time off for whatever reason you're given, be skeptical about that reason and be very, very careful.
hmm Yeah, I'm going to add to that too as a trainer from my perspective. I know a lot of our audience is in the US, and one of the issues that comes up a lot is travel, because this is a big country and horses are so far apart, that when you decide your budget, one of the things people don't figure into their budget is not only the travel to go see the horse, potentially the travel to take a professional with you, because I know as a trainer, I would much rather see that horse up front and give you advice than have you buy that horse and then bring it to me to fix it once it turns out to not be the right horse, or what you thought you were buying. But also, you need to budget for failed pre-purchase exams too, because if you're flying around looking at horses in different places, and you get your heart set on one, and then you vet it and something comes up, it can be really it can dissuade you from listening to the information that you're being given, if you're thinking, I can't afford to go to another place and buy, and look at more horses in another state, or fly, my trainer out to look at more horses. And so you really it's tough because horses are so expensive, and a lot of times we're trying to maximize our budget for the sale, but that money's just down the drain if you buy a horse that you shouldn't, whether it's for temperament or soundness reasons. So yeah, that, like I said, that's something that if you've been in the horse industry for any length of time at all, you're going to have stories about that either happening to you or happening to someone else. And I don't know about in the UK, but here there are laws about how much commission agents can take, and that they have to disclose that they're an agent. And so it's important to have, like you said, to have that information about the people that are advising you. And like it's tough when you're new to the industry to know who to trust. It's worth asking more than one person a lot of the time, or asking around about the person that you're working with, and see if a lot of times if you go look at multiple horses, you can ask about the other places that you're going, and not necessarily, take some of that information with a grain of salt, because it's not only a crooked industry, it's also a gossipy industry. But more information is always better than having less. And you can't really take things at face value when it comes to, especially with sales. There's a reason that horse traders have the reputation of being crooks. It's more often than not, there's something that needs to be questioned. So then once you have your budget and you decide what horses you're going to look at, and you get your advice, professional advice, and then you go to look, and you after you've investigated the horse's record and show history and all of that, what do you recommend that people do when they actually go look at the horse?
I think, first of all, just stand and look at the horse. And perhaps we could have the slides, Megan, so that we can talk around the slides. Because I think looking
Yes,
at
I'm going to pull that up real quick.
And its muscular development and its overall conformation can tell you quite a lot about how that horse has been working and what its prospects as an athlete are. So I'm always looking to say, well, is this horse built in a way that is going to encourage it to work in an uphill way? And if we look at the lines of the wall, and we look at this horse's conformation and the relative heights of the withers and the jumper's bump, we can see that the jumper's bump is higher than the withers. So this horse is inherently built somewhat downhill, and it's therefore going to find it quite difficult to adequately engage the hind limbs. So this horse might make a totally safe riding club type level horse, or a pleasure horse, but this horse is unlikely to make a higher level competition horse just because of its conformation. Then I think it's really important that you look at the feet. So this is an 8-year-old warm blood. And if we look at the front feet, we can see that they're very asymmetrical in shape and size. So the left front foot is to the right of the picture, and the left front foot is taller and more narrow than the right front foot. And if we look at the line of the coronary band, on the inside of the foot, the coronary band is higher than on the outside. And there is very substantial evidence that horses with asymmetrical front feet are more likely to leave the ridden horse industry earlier than horses with symmetrical front feet, and that's because of lameness. And so to me, it's really important to look at the symmetry of the front feet. And if I saw a horse like this with marked asymmetry of the front feet, I would be saying to the potential purchaser, I think that this represents an increased risk for future development of lameness. And in fact, the horse may already have been lame. So I personally would not buy a horse with asymmetrical front feet like this. So that's something which I think is really important to look at.
Would that also include like a low heel?
Yes, I think we have an example of a horse with a very low heel.
There we go.
There we go. So in this foot, we can see that the heel angle is much smaller than the angle of the front wall of the foot. And when we look at the rings on the feet become slightly more separated towards the heel than they do on the front of the foot. And we can also see that the coronary band has got a rather curved shape. And all of these features are not good features to have. This horse's heels are not only low, but they're rather rolled inwards and crushed. And this horse is going to be highly susceptible to the development of foot pain. We can't say specifically what type of foot pain. It could be more susceptible to the development of navicular disease or trauma to the back of the pedal bone or trauma to the soft tissues of the back of the foot. Whatever, this is not a good foot to start with, and it's going to be a farrier's nightmare as well. So I know of some people, when they're buying horses, they not only send photographs of the horse when they go and try it to their veterinarian, they also send photographs of the feet to their farrier, so that the farrier can say, oh, I don't like these feet, please don't buy this horse, or I do like those feet. That's a good starting point. So I think foot conformation is hugely important. Let's go on and look at the next picture. And we also need to look at the horse from behind. And when we're looking at the horse from behind, the horse needs to be standing, bearing weights evenly on all four limbs, and must be standing squarely behind. And if the horse is standing squarely behind, in a normal horse, the hindquarters should look symmetrical. But we can see in this picture that the left hindquarter is much flatter and is effectively lower than the right hindquarter. And this is likely to reflect the previous presence of left hind limb lameness. To buy a horse with asymmetrical development of the hindquarter muscle mass is a very high risk. There is data from several studies which have shown horses longitudinally, insurance company data that shows that these horses are at much, much higher risk of developing lameness. And it is likely that this horse currently is showing some degree of asymmetry of gait. So if I saw a horse like this, I probably wouldn't go any further. I wouldn't even see it ridden. I would stop here and say, I've got to be strong with myself. This is a warning sign. I don't want to be carried away by looking at the horse doing some fancy movements under tack, for example, because that then may sway my judgment. So use these early warning signs to say, no, this is not the horse for me. And then we can proceed with watching the horse move in hand and on the lunge with the vendor or the seller, and then also see the horse ridden. And when you're seeing the horse ridden, you want to look at the horse from all perspectives, from the side, from the front, and from behind. And in this horse, looking at it from behind, we can see that the saddle is slipping way off to the right. Now, we know there are a number of different reasons for saddle slip. It may be because there's a crooked rider. It may be that the horse's back is asymmetrically muscled. It could be that the saddle is asymmetrically flocked or stuffed. But the most common reason is hind limb lameness. And so this is a warning sign that the horse may have hind limb lameness. So I would be erring on the side of caution and not probably wanting to go much further with this horse. So those are the things I want to see. And I'm going to ask the rider who is showing me the horse, if they haven't volunteered to do so, I would like to see them ride the horse in 10-meter diameter circles to the left and to the right in rising trot. And I want to see them perform multiple transitions, because what tends to happen is that the seller shows the horse doing lots of easy movements, making the horse look good. And you can understand why. They want to sell the horse, but you want to see the horse do its full repertoire of movements and put together in a fairly complicated way. And you want to see the horse do the things under the circumstances in which it may highlight that there's a problem. And you're going to do the same thing yourself when you ride the horse. And it's really important that you ride the horse and don't feel intimidated by the seller. And I would, if you're buying a horse which is going to jump as well as work on the flat, I would always encourage you to ride the horse after the seller has shown the horse working on the flat. Then you ride it on the flat, because then you will feel it as it is before it's become excited by jumping. Mm-hmm. If you see the horse jumped, then when you get on it, it may feel very different than it would have felt before it jumped. Mm-hmm. So I would advise you, see the horse work on the flat, then you work it on the flat, then see it jumped, then you jump it, and then don't just ride the horse in an arena. If it's at all possible to take the horse out and into a field, take it down a lane, just seeing how it's reacting to different environments, I think can sometimes be very revealing. And all the time, try not to be too influenced by what the seller is telling you. You may be struggling to, for example, ride this horse on the bit. And so often I hear in the background, if this is being videoed, the seller telling the purchaser, oh, you'll get used to riding this horse. You just need to practice. You just need to learn to press the right buttons. Well, if the horse has been properly trained, it shouldn't be that difficult to be pressing the right buttons. So don't be too influenced by the seller telling you you're going to make this horse better. Mm-hmm.
Yeah, for sure. There's, I think a lot of people go in thinking that if the horse is, has some training issues, that's a way to get the horse for less. But I can't count how many times I've had someone buy a horse for those reasons, and then it's actually turned out to be a soundness issue. If there's a training issue, if a horse is reasonably trained, it should be rideable by anyone who's a reasonably good rider. And if you're not a reasonably good rider and you're buying a horse, then you need to bring someone with you who is a reasonably good rider, and that horse should go reasonably well for that person.
Absolutely. Yes.
Okay, so when you find the horse that seems to fit what you're looking for, and you've done all that, the next step I would think would be to find a vet. And we just did a whole live a couple of weeks ago about choosing a vet for yourself. But a lot of times people are, buying a horse in a different location. What are some considerations when you go to decide what vet you're going to use for the pre-purchase exam?
Well, you don't usually want to use the vet who works for the seller.
Absolutely.
Because they're going to potentially be biased. However, in some countries, which includes the UK, if the seller's vet does the pre-purchase examination, they are duty bound to release all the veterinary records for that horse related to any work they have done on the horse or any of their professional colleagues have done on the horse. So that is a way of potentially gaining inside information about the horse's records. Now, if I'm going to do a pre-purchase examination, I would always ask the vendor, has the horse had any previous lameness problems? Has it had previous surgery? Has it had any medication in the last X weeks, etc.? And then I get the seller to sign a form validating their responses to these questions.
Mm-hmm.
So you want to avoid most of the time the vet that is working for the seller.
Yeah. I would add to that, in the US, I don't believe that it may vary from state to state. I don't believe there's any requirement to release those records. But I do find that if you ask for those records and they're refused, that's a pretty big red flag. And I've even known some trainers that specifically use different vets for their routine care versus their lameness care, so that if they're asked for records, they can give only the ones that don't show anything. Exactly. So I think it's a good idea, good advice to have the seller sign something saying that they've disclosed anything. So if something comes up later and there's information that it wasn't fully.
Yes. Then I think if you don't know anybody in the area, then you need to ask people if they know somebody in the area that they can recommend. And don't ask the seller who they're going to recommend, because they sometimes have somebody that they work with who's not their normal veterinarian,
right,
but has a relationship with them for pre-purchase examinations done for them. And I'm sorry to say this because it doesn't reflect terribly well on the veterinary profession, but this does happen. And so therefore, I think you have to be very careful in the selection. And I often get asked, can I make a recommendation for somebody? And I will always try and give 2 or 3 different names of somebody that I can trust in that area. And if necessary, I will ring people that I know in the area saying, who do you think? Who would you recommend under these circumstances? And once again, it needs to be somebody who has some knowledge of the type of work that you are going to want to do with this horse. So if it's a veterinarian that is an expert in reproduction and you want to buy a potential show jumper, that is not the right person to be doing the pre-purchase examination.
Yep.
It needs to be somebody that is competent and has knowledge of what goes on in that sport. So, for example, if you were buying a horse for reining, you wouldn't necessarily be using the same vet that you would use for an upper level dressage horse. They may have knowledge in both areas, but you need to be aware of that.
Yeah.
And we talked about selecting a vet before in terms of the willingness to see the horse ridden. My personal belief is that it is hugely important to see horses ridden during a pre-purchase examination, because, as we've discussed before, there are so many horses that are move adequately in hand but appear abnormal when ridden. So for me, ridden exercise is a crucial part of the pre-purchase examination, although it is not a mandatory part of the pre-purchase examination in many countries, both in Europe and in the USA and in Australia and New Zealand. So I think you have to make it clear to the vet performing the examination what are the minimum requirements that you want. Each country will have a system under which the pre-purchase examination should be performed. But if you want to see the horse ridden, you've got to say, I want that horse to be ridden, and I want you to evaluate it carefully during ridden exercise. And I think if you have had question marks about things that you have observed, or there's something that's worried you about from the history, it's really important that you make the veterinarian aware of your concerns. Or if you've had a horse with previous problems and you are absolutely worried about buying another horse with the same problems, make the veterinarian aware of that. I always think as a veterinarian, it's much more easy to make a decision for somebody when you know something about their background, when you have a relationship with that person already, because then you know more about their attitude to risk. You probably know a little bit more about their financial situation in terms of how much money they're going to be gambling and what their attitude, how much they can afford to potentially lose. Because we have to remember that as a veterinarian performing a pre-purchase examination, you are looking at the horse on the day. You're going to try to be as an efficient detective as you possibly can be to find out the maximum amount of information you can about that horse on that day. But you do not have a crystal ball. All you can say is, this is how the horse has appeared today, and therefore I think it is a reasonable risk for purchase for your 16-year-old daughter to take on to amateur level show jumping. Or you might say, I found X and Y, and I think that this horse is not a reasonable risk for purchase for an amateur level show jumper for a 16-year-old coming off ponies, for example. So the amount of information that's exchanged between the purchaser and the vet should be as much as possible, I think. And when possible, I would always recommend that the purchaser attends the pre-purchase examination. Absolutely. So that you can have discussions about what is observed. If the purchaser can't be there, then I would, as a purchaser, say, please ring me if you find something. Don't just keep going to the end, and certainly don't go acquiring expensive Xrays until we're sure that the horse is fine clinically. Because if the horse is not fine clinically, what you find on imaging is not going to make the horse any better. So don't go through the expense of lots and lots of images if clinically the horse is clearly not suitable.
Yeah, and if you are not experienced with this process and haven't been through it before, it's another thing to potentially budget for, is to have your professional person that's advising you be present for the pre-purchase, because someone who knows you well and knows your riding and knows what you're looking for, who has more experience with things that might come up, I've found in my career has been invaluable to people, that they can advise on whether something is a deal breaker or something that needs more investigation, that kind of thing. What are some other things that you should talk to the vet about in terms of what's going to be included in the exam and how the exam is going to proceed?
Well, I think in most countries, it is a mandatory part of the examination that the horse should be evaluated clinically by palpation and observation from head to tail, effectively, which includes looking in the mouth. You will be looking to see if there are any surgical scars. You will be evaluating the horse as intimately as possible, but without the expectation there's going to be, for example, an examination per rectum, because that would not be a standard part of a pre-purchase examination. Then you would expect that the horse is trotted in hand and flexion tests of the front limbs and the hind limbs are performed. contrary to expectations, in many countries, lunging exercise is not a mandatory part of the pre-purchase examination, nor is ridden exercise. And I would suggest to you that you should request that both of those things are done, that the horse is seen lunged, both on a soft surface in trot and canter and on a firm surface in trot, and then seen ridden. And then in the UK, we have a system whereby the horse then stands quietly, having been untacked, stands in the stable for about half an hour, and then is re-evaluated moving in hand, because sometimes you will pick up lameness then, which was not apparent previously. As somebody conducting a pre-purchase examination, I would always want to contact the vendor ahead of time to request that the horse has not been worked prior to me coming, and that the horse is in its normal environment. If it normally lives out 24/7, then it's fine, it's in the field. But if it's normally in the stable for several hours in the morning before it's worked, then that's how we should be looking at it under the normal circumstances that it's kept under. I also request that nothing is put on the feet, because vendors often put all sorts of stuff on feet to make the feet look glossy and potentially to hide cracks, etc. And so stuff on the feet is a no-no for me. I would like to see the horse in its natural state, as it were, because it makes it easier to detect cracks. So that's quite important to me. So I, as a veterinarian, would do the fullest examination I could possibly do. Palpation, manipulation. I want to see the horse's flexibility of its back. I want to palpate its back very carefully to see if there's any abnormal muscle tension or pain. So it's like putting every bit of a physical examination together. And this is going to take me about an hour and a half to do properly. I don't think it can be done more quickly than that.
Yeah, and that's, I think, it may be a specifically US thing, but I feel that one thing that comes up a lot is pressure to keep it under a certain amount of time, because vets are always in a hurry to get off to the next thing. So I think that is one question that is important to ask ahead of time when you're choosing your vet, is how much time do you set aside for this exam, and what will happen if something comes up during the process of the exam. Will you be able to further investigate, or will you need to come back a second time? Those are things that can be sorted out beforehand.
Yes, I always try to avoid second look examinations, because if the horse is lame, for example, on the left forelimb today, and the vendor says, oh, it's never been lame before, it might have a tight nail, I'll get my vet to look at it.
It comes up frequently.
And then you're then asked to go back in 2 weeks' time. Well, the horse has been rested all that time, generally speaking, and you as a veterinarian are placed in a very difficult situation because the horse has been rested, and you don't know whether or not that problem is going to come back. So if the horse is lame at the time, unless there's something really obvious, which is clearly something which is readily resolvable, then you need to walk away. You might say, okay, if this horse is still for sale in a month's time and you put it back in full work and you've gone back to competition, then I'll come and look again. But otherwise, be tough and walk away. And unless the vendor we've got good evidence that this horse has, for example, had a known problem that has been managed and that all that has been disclosed, then it may be a different situation if everybody is being open and transparent about what is going on. Now, I also think from a ridden perspective, I would also apply the Ridden Horse Pain Ethogram. And I would recommend that you do that when you go and try the horse, but I would also do it during the pre-purchase examination. And I wanted to show a case example of a dressage horse. So if we could just go back to the slides, and we're going to talk about this horse's history. We'll get to it. This horse was being bought by a lady, and it's going to be her last dressage horse. She has previously ridden at Grand Prix level, and she wants to buy a horse at a lower level and take it up to Grand Prix in the ideal scenario. So she's been to see this horse. It's a 9-year-old warm blood, and she had found out that its scores in dressage were usually in the low 60s, but had ranged between 54 and 67%. Now, 67% wouldn't be bad. I would be worried about the 54% personally. Sure. Now, on my clinical evaluation, the right hind quarter was marginally less well muscled than the left. That's number one alarm bell. Number two alarm bell, the lumbar and pelvic muscles were poorly developed. And this is a dressage horse. And we shouldn't see poor muscle development in the area behind the saddle, the lumbar region, or the region of the hindquarters. So this horse was disproportionately muscled in terms of its neck was reasonably well muscled, but its back and hindquarters were not. And also, when I felt the back, there was increased tension in the muscles behind the saddle, especially on the right side. And there was asymmetrical hair wear underneath the back of the saddle, suggestive of saddle slip to the right, another warning sign. So let's go to the next slide, please. And this horse, when it was evaluated moving in hand, did not show any overt lameness, but just didn't move very fluently. It was rather stiff behind. And similarly on the lunge, it lacked hind limb impulsion and engagement. And when it was ridden, was not lame in the conventional sense, but was one-paced and lacked hind limb engagement and impulsion. And the saddle slipped to the right, as we had predicted, in canter more than trot. Let's go to the next slide. And this is the form that we use for recording the Ridden Horse Pain Ethogram behaviors. And we saw 9 out of 24. And this tells me that this horse must have underlying musculoskeletal pain and is a way of convincing the purchaser that this horse is not suitable. It doesn't show overt lameness in the conventional sense, but it's showing 9 of the 24 behaviors. Not necessarily all the time. We can see that the tail swishing was only seen in the more difficult movements, but it's still a warning sign. So I would say on the basis of all these observations that this purchaser should not proceed with the purchase. And there's no point me going on with any diagnostic imaging because that's not going to change my decision. Okay, so I think we've finished with that case.
Yeah, one thing that occurs to me is a question that you need to think about is where the exam is going to happen. Because I've had situations where the horse is hauled into a hospital, and not all veterinary hospitals have riding facilities. Oh, is Sue gone?
No, I'm back.
Oh, you there? Okay, I can't see you, but oh, there you are.
I'm back. We had a little emergency with the dog.
Oh, gotcha. Usually that's me. Yeah, so asking where the exam's going to be and what facilities are available where you're having the exam done, make sure that there are riding facilities available, because not every vet here in the US has that. And I've had situations where I think probably an exam would have gone a different way if riding facilities had been available during the pre-purchase. And yeah, I don't think we can underscore that enough, that the 24 behaviors ethogram is so valuable in this process, from the first time you look at a video to the time you go to look at the horse to the time that you're doing your pre-purchase. There are so many pieces of information that I feel now when I look at a horse, I feel much more confident in making these kinds of decisions about when to vet a horse, what risk I'm willing to take, and what imaging and other tests I want to do based on just even a layman's evaluation using the 24 behaviors. Do you want to talk a little bit about imaging?
Yes, I think imaging has a role. I'll hold my hands up and say that I've never acquired X-rays of any horse I bought for myself.
Wow.
Because I think that the clinical examination is hugely the most important thing. And we did some years ago look back at more than 100 consecutive pre-purchase examinations to make a judgment as to whether or not the imaging findings influence the ultimate decision of the horse to be bought. And there was only 1 out of 100 horses when the imaging findings ultimately resulted in the horse not being purchased. And I think it's really also important that the images that are acquired are of diagnostic quality and are interpreted correctly. Because nothing is worse than the purchaser thinking that the images have been acquired and have been told that the images are okay, and then subsequently the horse goes lame, and then another vet looks at those images and says, well, there were things here that were predated the purchase. These should have been observed. So I think that with modern day technology, that if there's any doubt about the interpretation of images, the purchaser's vet should seek the advice of an imaging expert to get a second opinion on those images. And that's something that you can request. If you have any doubts, ask for those images to be sent to an expert, because they are trained how to look at images. Now, they may pick up minute things which are of no clinical relevance, and that's always a bit of a problem, because then you might get a long list of things that are of very little clinical relevance. But at least you can rest assured that things that are important have not been missed, and that the images are of satisfactory quality. Then the question arises is, well, what areas do you image? Because you could finish up, and this often happens with horses being sold from Europe to the United States, in that there are requests for X-rays of the front feet, all 4 fetlocks, the carpi, that's the knees, the hocks, the stifles, the back and the neck. And then you finish up with this huge bill, which is much more expensive than the bill for the clinical evaluation. And the more X-rays you acquire in a mature horse, the more likely you are to find abnormalities which this horse is living with. And then that muddies the waters. How do I interpret this? What is or is not of clinical significance? Now, one time when I do think that it's potentially important to acquire images, at least of, for example, the front feet and hocks, is if you are buying the horse with a view to selling it on in the relatively near future. Because then you need to know that you've got sellable X-rays that are going to be acceptable for another purchaser and their veterinarian. So I think under those circumstances, it's worth having images, X-rays. The next question that arises, well, should you scan the soft tissue structures? Where do you stop and start? Do you scan in an event horse the front limb superficial digital flexor tendons, because they are quite commonly injured? In any type of horse, do you do ultrasonography of the suspensory ligaments. But what you have to bear in mind is that unless the vendor, the seller, is giving you permission to clip the hair coat, the quality of the images may not be good enough in order to make an accurate judgment. So lesions may be missed. Imaging of hind limb suspensory ligaments is one of the most difficult clinical areas to do, and people's interpretation varies. And you also have to bear in mind throughout this entire process is that we're living in a litigious world.
Mm-hmm.
And that places veterinarians often in a rather defensive situation.
Yeah.
And it is easier to say, don't buy the horse, than it is to say, buy the horse.
Mm-hmm.
My philosophy has always been the vendor wants to sell, the purchaser wants to buy, and therefore we should be trying to enable this transaction to take place unless the risks are too high. But I think that more and more veterinarians are acting more cautiously because they are afraid of litigation, and therefore they're more likely to say, don't take that risk.
Or even just reputational damage as well. I think, if someone buys a horse and it goes lame, the, word can get around really quickly that it passed a vet check.
But I see as the most common problems, and I've been involved as an independent expert witness in cases surrounding pre-purchase examinations many, many times over.
Mm-hmm.
And the most common reasons for lameness becoming recognized soon after purchase are failure to recognize abnormalities on X-rays, failure to recognize that the horse moving short without overt lameness actually probably is uncomfortable, and failure to recognize that the horse which is behaving abnormally during ridden exercise is reflecting discomfort.
Mm-hmm.
So the vet doesn't see overt lameness, so they say the horse is okay, and it's not okay. We always have to bear in mind, however, that there are many, many things that change when a horse changes ownership.
Right.
The tack is going to change, the rider is changed, all the management changes, the farrier changes, the food changes. And so there are many different factors that can tip the horse from being a satisfactory performer to an unsatisfactory performer. So whilst many times I think that problems have arisen as a result of problems with the pre-purchase examination, we do have to recognise that there is a risk involved in a transfer of ownership.
Absolutely.
And just working on a different footing can make an enormous difference to a horse.
Absolutely, yeah. I think that's a great point, that people want to sort of narrow it down to sound versus not sound. And that's why, in the old days, they used to say pass fail or percentage risk. And I think both for liability reasons and for just, reasons of acknowledging all the things you just listed that change when a horse changes hands. I think that has shifted, and we realize now that there's no way to really know what's going to happen in the future. It's just about gathering that information and making an informed decision.
Yeah, I always think it's fair if the purchaser says to me, would you buy this horse for yourself?
Yeah.
Because I think that's a fair question to ask.
Mm-hmm.
And I will be straightforward with somebody and say either yes or no, and try and give my reasons to know as to why it should be no.
Mm-hmm.
I will say that when people have gone ahead and purchased horses despite my recommendation not to buy the horse, usually they've run into problems subsequently, and those horses have been difficult to manage. So I would say, do listen to your veterinary surgeon or your veterinarian. They are a professional. They're giving you advice. So listen to that advice and don't be ruled by your heart, even if this is the 30th horse that you've seen and the third horse that's undergone a pre-purchase examination, if they're telling you not to buy it, then think very carefully about that.
Mm-hmm.
One other issue that comes up in Europe, and I think in some instances in the United States, is whether or not you want to insure the horse.
Mm-hmm.
Because if you're going to insure the horse, the insurance company, particularly for high valued horses, will have criteria by which they will take on the horse as a risk or not. And it may be necessary that you have to send the veterinary report to the insurance company to say, will you take this horse on as a risk? Or are you going to exclude X, Y, and Z from cover?
Mm-hmm.
And that process needs to be done before you agree to purchase the horse or otherwise.
Mm-hmm.
The other question that also arises is, should you be collecting blood from the horse to analyze the presence of drugs that may have influenced the horse's performance?
Mm-hmm.
And in the UK, there is a system that is run by the Veterinary Defence Society whereby you can collect blood into specialised tubes and you can send them to a specific laboratory where either they can be tested specifically for certain substances such as phenylbutazone, or they can be tested for all substances, or the sample can be stored for a set period of time. And if problems arise, then that sample can subsequently be analysed.
Mm-hmm.
There are different systems in different countries,
Mm-hmm.
but I do think that it is often worthwhile to have blood at least collected and stored in an appropriate fashion. And that's got to be done in a way that is legally binding, which is what the Veterinary Defence Society scheme is. I'm not sure what the situation is in the United States.
Mm-hmm. Yeah, I know that I've always had them collect blood and hold it for future problems as long as there's no clinical reason to test it sooner. I don't know what they're legally required to do or bound by. It strikes me talking about all this that when I was younger and we did pre-purchase, it was much more of a black and white situation. And now as we've become able to, we used to have analog Xrays that I'm sure if we looked at now wouldn't tell us anything. And I'm thinking, as the technology has advanced and as we've gotten genetic testing and all of these other lab tests, and even as we've gotten the 24 behaviors ethogram, it hasn't made it easier to determine when to buy a horse and when not to. It's actually made it a little bit more complicated, or a lot more complicated. And I think that's really telling for this whole conversation that what you're doing is gathering information and making an informed decision, and more information is helpful to the extent that you're making that decision with information, but it's never going to be something that gives you a black and white answer. It's always going to be what risk are you willing to tolerate, and just from your answers, what seems to be taking shape in my mind is that it really is about having an experienced professional that you trust to ask her advice during this process, whether you're experienced or not. It's good to have a second person involved that isn't the purchaser, that isn't biased in terms of either fear of something going wrong or really wishful thinking of wanting it to work out.
Yes. I think that whenever we're buying a horse, it's an expensive investment.
Mm-hmm.
And I think that going into it, you need to be very aware of what money you can afford to lose. Because even with the best evaluation, things can go wrong. The horse could have an accident, or it could become lame, and therefore you have to be aware of that. So don't spend all your money. You need to have some in reserve. You need to have some in reserve in case something goes wrong. so that you have the money in order to pay veterinary fees, pay for rehabilitation, etc. So I think that to overspend your budget is a bad idea.
Yeah.
So be realistic in what terms of what you can afford, pay, and knowing that there are going to be additional costs after you've bought the horse.
Yeah, it's infinite. It seems like a lot of the time. You can spend any amount of money that you have and more, for sure. Going back just a little bit, I don't think we talked. Now, we did a whole live on spinal issues, and I know that's something that's come up in pre-purchase a lot recently with clients, is that now that we have the capacity, like I said, there's more technology, we have the capacity to image more of the horse's body. Now there's information about issues in the spine, and a lot of disagreement, it seems like, in terms of what significance that has. And I know we keep coming back to evaluating the horse for clinical signs, particularly under saddle. Do you recommend including things like spinal imaging, neurological exams, things like that in the pre-purchase?
The neurological examination would unquestionably be part of my overall clinical assessment of the horse. I do that with every single horse that I'm looking at. So yes, that's absolutely part of it. Would I recommend X-raying the back? I would say no, because I think that you need to be using tools that are going to potentially influence decision making. And I don't think that acquiring images of the back are going to influence your decision making. They're just going to muddy the water.
I think
it's
that's
very interesting that in Germany, radiography of the spinous processes of the back used to be a mandatory part of the pre-purchase examination. And they have now withdrawn that because of the amount of sales that were lost based upon X-rays when horses went on and performed subsequently very, very, very well. So they have taken the step of saying, we do not require that radiographs of the back are acquired. And I think that was done for a reason, and I think it's a very good reason, and I would thoroughly endorse that.
Yep.
As I think the more X-rays you acquire, the more difficult it becomes to make decisions, because you're going to find variants that are not of clinical significance. And if you're acquiring X-rays of the back, most people are only going to acquire X-rays of the spinous processes. They're not going to acquire X-rays of the articular processes or the vertebral bodies, because those will be out with the scope of the normal X-ray generators that vets in practice will have. And therefore, just because the spinous processes look normal doesn't mean the rest of the back is abnormal. It is normal.
It's normal,
so, you're only looking at the tip of the iceberg. So unless you were going to do a completely comprehensive evaluation, and I don't think it's justified if the clinical examination is good, that the horse is well muscled over its back, it's moving through its back well, why would you want to X-ray the back? Believe your clinical evaluation.
Yeah, I don't think we can emphasize that enough, because that's something that I've seen in very recent years coming up a lot, is what, people having heard horror stories about, kissing spines and failed surgeries and all kinds of things like that they feel that it's worthwhile to image the back, and then it, like you said, it muddies the waters, and you end up with either people moving on from horses that they should have been more willing to consider, or you end up with people just not knowing what the clinical significance is of these images, and the fact that there is the background of you're requiring them and then deciding that it wasn't worth it, I think would be very valuable information for people to have when that topic comes up, whether they should do that kind of investigation or not. And I think that it's very undervalued looking at the muscling in addition to watching the horses under saddle. I think people know that they're supposed to look at the muscling, but nobody teaches them how to look at the muscling. And, horses are not machines, so there's no such thing as perfect symmetry. And so learning the nuances of what symmetry is important and how much asymmetry is acceptable. Maybe that's something that we should look into doing more education on, because
yes, I think so. And I think that encouraging vets to use a comprehensive checklist during their pre-purchase examinations is to be encouraged, because then that forces you to do things in a logical way and encourages you not to miss things out. So I did develop a check sheet that was then incorporated for recommended use by the British Equine Veterinary Association. I think we're going to make that available via the website.
Awesome.
So I would encourage veterinarians to use something similar, not necessarily this one, but use something similar, because I do think it's helpful to jog your memory about the things that you need to be checking.
And for buyers to realize that it's not a standardized process. If you've never been through multiple pre-purchase exams, you may not realize that some are much more thorough than others, and it really does matter. I think people might come in assuming that there is a standard way of doing it, and I think
it's important to realize that it's not. So even within continental Europe, the system in Germany will be different to that in Holland, which will be different to that in France, which will be different to that in the UK. So if you are a USA buyer coming over to Europe, you need to be aware of how the examinations differ in different countries.
Especially because in that situation, it's even more likely that you're not going to be present for the exam, and no one that is going to be present for the exam. And so there's always a risk buying a horse from a different country, but or any horse for that matter. But that I don't think people are always aware that that's the case, and it makes a huge difference whether you have the horse evaluated at a major hospital or in a different, in some of the countries, the sale will be going through in one country and the exam will happen in a different country because they're so close together. So there's all kinds of things to consider for that. We talked about neurological, we talked about drug testing, we talked about spines. One thing that came up in our comments or replies before this was a question about genetic testing. Now there's all kinds of options for things, particularly for metabolic, PSSM, MIM, genetic predisposition tests. Can you talk at all about the usefulness of those, or whether they'd be worthwhile? I know that they take often weeks to come back, and that can be an issue. If you ask for it at a pre-purchase, you're not going to know and be able to make a decision right away.
I think it depends on what genetic test you're using for what condition, because there are certain genetic problems that we see in specific breeds, but there are others that go across the breeds. And for example, with PSSM, I would be much more reliant on my clinical evaluation rather than relying on a test which is not 100% specific. So a test when you can have false negatives and false positives, and also for which you're going to have to wait weeks for an answer, is not to me a very satisfactory test to be utilizing. So I think in the majority of circumstances, knowledge about the horse's history and the results of the clinical evaluation are far, far more important.
I think people need to educate themselves about those individual tests, because a lot of that technology is new and people might assume that it's a little bit more black and white than it is.
And it depends on the laboratory too, because there are some laboratories which are very kosher and have very strict controls, and their work is very well validated. And there are other commercial laboratories which are not so reliable.
Yes.
I'm not going to name names, but there are some laboratories in the United States that I'm aware of that I certainly are aware have not undergone proper validation. And therefore to send a sample to be tested to one of those laboratories would be money very poorly spent.
Yes, I just a little anecdote. I remember selling a horse, and the buyers that decided to, this was back in the 90s when EPM was a fairly new disease, and the buyer's vet ran a blood test for EPM and then came back and said, this horse has EPM. You can't buy this horse. And at the time, this was pre-internet, so I didn't even have the ability to Google what are they talking about. And so I found an article with a phone number on it and called someone at University of Kentucky and said, does my horse have this horrible neurological disease? And she said, well, first of all, no, because it just means that your horse had a titer count that it was exposed to an animal that had the disease, not to the actual disease in the spinal column. And also the testing that they ran was at a lab that has no credibility. And so it doesn't matter whether it was positive or not, but I wouldn't accept these results if I was looking to diagnose a horse in the first place. So it does pay to educate yourself about specific tests and specific diseases and what is even worth running a test for. And it seems, again, the more technology we have, the more muddy the situation gets. But you have to do research. Even back in the days before Google, we had to do research to figure out what information was worth taking into account and what we had to sort through and not worry about. The other comment that we had before we came on was about specifically like ovarian cysts and hormonal issues. I know we did a whole live quite a while ago about moody mares and issues that potentially affect a mare's soundness. Do you want to say anything about pre-purchase exams for mares being any different?
I don't think that they are any different, really.
Yeah.
So that's the simple answer, really.
Yeah.
I think that if you are buying a horse with a view to breeding with that horse, be it a stallion or a mare, you might want to pay more attention to something. For example, the conformation of the mare's vulva. So if she's got a very sunken vulva and the lips are very separated, that is not a particularly good conformation to have for a mare. So you may want to be asking for advice about that. But beyond that, I think it's, or if it's a stallion, you obviously may want to have its semen evaluated so that you know about the quantity of semen and the motility of the semen, so we know something about the semen quality. But those are more specialized things that for a breeding examination, which is not really for a performance examination.
Here's a question about that. If you're buying a mare that is on Regimate or some other hormonal control, would you want to examine it? Would you want to take them off that to examine it, or would you be fine with just examining them in the same?
Well, I personally don't think that from a performance point of view, Regimate makes a huge amount of difference. I was involved 2 years ago in a horse which had been treated with Regimate, and they said it was made the horse a lot better.
Mm-hmm.
I felt the horse had physical problems, and I think that they were attributing its behavior to being so-called marish behavior when I felt that the horse had physical problems, and I advised that the purchaser didn't proceed with the purchase anyway because I could see that there were physical problems.
Mm-hmm.
I had not been told by the purchaser or the vendor in advance of the examination that this horse was on Regimate, but when I did my normal questions about is your horse on any medication currently, or has it received any medication in the last 6 weeks? So they said, oh yeah, it's on Regimate.
Yeah, I guess my question about that would be, why did they put it on Regimate?
Absolutely. I mean, they were open. They said, well, this that she seemed a bit marish. So but I think they were interpreting marish as being not cooperative
Right.
as she would
So in
be
other words,
ideally, and that she wasn't being cooperative because she was uncomfortable.
right. So in other
She had
words,
musculoskeletal pain.
you would consider it a bit of a red flag if they're
I would
administering
be always,
for
I'd be saying
performance
why,
issues. Right.
why, and be questioning the person very, very carefully about what changes they had observed or not before the horse was on Regimate and now.
Hmm. Yeah, it's more information. That's all of the questions and comments that I saw before we started. Megan, is there anything in the comments that we want to address?
We don't have any additional comments that I can see. And sometimes it turns out that after the fact, that wasn't the case. It
Yeah.
changes all the time, but we will definitely try to get your questions answered afterwards if there are comments on there, questions that we haven't seen. I'm going to go ahead and share screen again as well. So if y'all wanted to take any notes about our upcoming lives or some of the resources that we have available that we discussed during this live. So, of course, always referring back to the 24 behaviors checklist as such a great tool. Imagine a world where your seller had years of monthly logs of the 24 behaviors checklist that you could look at. And let you know what might have been some ups and downs with this horse. So using this during the pre-purchase exam, but using it always just for yourself and for your horse is such a great idea. We have the free mobile field guide, which has illustrations of the 24 behaviors. We have the 24 behaviors checklist, and we have an additional behaviors checklist, which is going to be one of our upcoming topics. I can't remember. We had slated that as being our next topic, but Jody and Dr. Dyson, we were discussing just prior to this live about some things that have been going on in the media that would probably be worth discussing and that people would probably want to hear Dr. Dyson's perspective on. So do you guys want to talk about that a little bit?
Yeah, I think if you're involved, particularly in the dressage world, but horse world in general, and if you even watch the Olympics, and sometimes I think this stuff leaks out even to non-horse people, you know that there's a bunch of welfare conversations going on, and specifically in the last 24 hours or so, a lot of conversation about blue tongues. And Dr. Dyson is on the record as having taken a position on mandatory double bridles in upper level competition. And so I thought it would be interesting, Dr. Dyson, if you would like to talk about that as a topic for a live, maybe for our next topic, since it seems to be something that everybody is curious about.
Yes, I'll enter the lion's den.
Okay, well, that we will title our next live. So check this date, Thursday, September 19th. That is when we will be talking to you. And we will probably be talking about the lion's den, as Dr. pointed out, of some of the issues going on. But at the forefront, always our concern with everything we talk about here has to do with equine welfare and the welfare of the humans who are caring for these horses as well. So we will focus on that again. Thursday, September 19th will be our date, and we'll look forward to seeing you there. We always want to remind everyone that Dr. Dyson does have a book out that she authored together with Sue Palmer about the use of the Ridden Horse Ethogram and how that can be used and is a really helpful tool to go along with your mobile field guide. And again, a reminder, we are a nonprofit organization, so if you like the content that we're creating and the free resources that we make available, please feel free to donate to us if you're so inclined. And we'll hope to see you guys next time. Thanks so much for joining us for this conversation and all of these conversations, Dr. Dyson. And we'll see you all next time.